Hello, I am Dr. Rashawn Venerable, a board-certified ophthalmologist. It has been said the eyes are the windows to the soul. When we make eye contact with another person, we are making a subconscious assessment of their alertness, state of mind, and interest. As we age, the eyelids show telltale signs of aging with wrinkling, puffiness, and drooping of the eyelid skin. These changes can be environmental and/or inherited. These changes can give a false sense of tiredness and boredom. Eyelid surgery, known as blepharoplasty, is a procedure that is done to remove redundant skin from the upper eyelid that is hanging over the eyelashes, causing hooding and decreasing functional peripheral vision. This procedure improves the appearance of the upper eyelids and gives a rejuvenated appearance, making you look more rested and alert, safely and effectively. Blepharoplasty only corrects vision loss due to excess skin, muscle, and fat that blocks the eye. By removing this excess tissue, this procedure may allow more light in and improve your peripheral vision. Blepharoplasty is performed as an outpatient procedure, which can be done in the office or in a surgical center. After surgery, you can resume driving and reading after a day or two, and back to most jobs in the same time period. During your consultation, you can expect to be asked about your health, desires, and lifestyle. We will test your peripheral vision to evaluate the extent of any visual obstruction and determine if any visual improvements can be accomplished with surgery. Insurances may pay for upper eyelid surgery if significant visual obstruction can be demonstrated. Certain medications and medical disorders can extend the procedure time or the recovery period, such as smoking, blood thinners, diabetes, and certain skin and eye conditions. Please inform me if you have any other conditions such as eye diseases, dry eye, glaucoma, or detached retina, thyroid disorders such as Graves' disease, cardiovascular disease, high blood pressure, or other circulatory disorders or diabetes. I look forward to discussing your individual needs during our consultation. Thank you for the opportunity to help you.
Upper lid blepharoplasty is done to remove redundant skin from the upper lid that is hanging over the eyelashes or hooding vision and decreasing functional peripheral vision of the patient. Upper lid blepharoplasty may be performed as an in-office procedure or at an ambulatory surgery center. Your surgeon will discuss the best option for you during your consultation. The upper lids are extremely forgiving in their healing process, and complications are extremely rare with upper lid blepharoplasty. Complications may include any untoward reaction for anesthesia. The anesthetic used is xylocaine with 1 to 200,000 epinephrine. Occasionally, your doctor may use Y-days. Epinephrine is used to constrict blood vessels locally and prevent bleeding. Y-days is used to promote dissection of the anesthesia among tissues to promote better anesthesia. Any untoward previous reactions to xylocaine or local anesthetics should be made known to the physician. Postoperative infection, which is extremely rare because of the vascular nature of the lids and the healing process. Lagophthalmos. If too much skin is removed from the upper lids, the patient will have difficulty closing the lids. This may cause slight opening of the lids during sleeping. However, this is rare since blepharoplasty is done as an in-office procedure with the patient awake, and complete closure of the patient's eye is required upon request during the procedure to estimate correctly the amount of skin to be removed and to promote closure of the eyelids postoperatively. Hematoma formation is a blood clot which may need to be evacuated by taking down the wound, removing the clot, and resuturing the wound. Sutures are used to close the incision, leaving the incision in a lid fold. Therefore, scarring is minimal. The scar formed is unnoticeable with eyes open, and over a period of time with the eyes closed, it is difficult to discern. Occasional small stitch abscesses or cysts can be found forming slight bumps along the suture line. However, this is also kept to a minimum with early removal of sutures postoperatively.